Hey guys, it's Whitney, your family practice PA here, and today I am super excited about our video because I feel like so many of my patients are always asking me these questions, and it's how do we decrease our risk of diseases like depression, cancer, dementia, arthritis. These are some of the biggest fears we all face. And we don't want to develop these, and we want to do everything we can to prevent having these disease processes. And one of the other big important things, one as me as a medical provider and two you guys as patients, is how can we do that and possibly not have to take medication? So where is that happy balance? So in today's video, I'm gonna answer that question for us. So the big answer, one of the big answers, is an anti-inflammatory diet or a low inflammation diet. So when we look at these chronic diseases, we can add on to this the high blood pressure, we can add on to it our heart disease, so many others. These are just a few that I picked out. And there has been study after study that has proven if we can decrease inflammation over a long period of time in our body, this can help prevent or at least elongate getting these chronic diseases. So with that, what type of foods is that? Like, what can we eat? What can we do? So there's a large number of foods that end up producing inflammation. And a lot of those are similar to other diets that cause high cholesterol, high blood pressure, and there's a link. And most of them come to, they produce inflammation. And us as humans, when we have that chronic inflammation in our body, it can cause abnormalities in our cells. It helps produce toxins in our body that help us fight these chronic diseases. So a large number of those foods are, and I'm gonna make a list of them on it so we can so you can hear me say it and visualize it, but a lot of them are these processed foods. So processed foods, which can be our white carbs, so white breads, pastas, white rice, so I'm just gonna put processed food. These are huge in producing inflammation, okay? These are our red meats that we talked about with the high cholesterol, which can lead to heart disease. It's our sugary sodas, so sugary, sugar drinks, sodas, a lot of our alcohols can have it, it's all moderation that produces it. So this is where these juices that we put in our children, things like that, they produce this chronic inflammation. And what we've realized is it's all about long-term changes. So it's these long-term sugary drinks, these long-term. So it doesn't mean you can't have any of them. It's just eating them over and over again for many years is what leads to a lot of those diseases that we talked about. It really just comes down to wanting to limit some of these examples of these foods, because if we eat those every day, there's a good chance we're gonna gain weight or we're gonna have high cholesterol. These are our heavy dairies also. So it's our saturated so it's the heavy dairies, it's our saturated fats, so that's our fried greasy foods. So all of these end up adding up over time. They build that plaque in the vessels. They do all of these different things that make us produce inflammation in our body. Our bodies don't work as well. We get that arthritis. We get the inflammation in the joints. We hurt. We have this chronic pain. We end up having to go on medications, and where medications can be great. And I'm very thankful that we live in an age. The whole idea is preventative medicine. So we want to prevent that chronic inflammation. We want to prevent the heart disease. We want to prevent the high blood pressure that can lead to the stroke, which then leads to our body not functioning how we were always designed to and how we want to. We want to be able to live independent, pain-free lives. So we want to limit a lot of these foods. So then our next question is, so what the heck do we eat? And this is where a number of studies have shown the best thing we can do is eat. Usually it goes back to what we talked about on my other videos that you can see on my channel on how to eat better for high cholesterol, how to eat better for diabetes. So the decreased inflammation foods are, it's our omega-3s. So it's our health, our fatty fish. It's our salmon, it's our nuts. It's our high fiber fruits. It's our wheat bread. It's not producing that quick sugary rush. So wheat breads. It is our Mediterranean type diet. So that gives us our olive oil. So we're cooking with extra virgin olive oil. We're eating, blueberries. It's high antioxidant foods that help us cleanse the liver, cleanse the body, get the cholesterol out where it's not building into the vessels. There's no plaque being built up. It raises our HDL, which is that good cholesterol, that H we want higher, and our L, which is our bad cholesterol that builds the plaques and vessels, we want that lower. So it all comes back into it. If you want to know more about the high cholesterol and what I'm talking about with HDL, LDL, what our numbers should be, check out my videos on my channel. It's all on there where I break it down further in detail. So what we're trying to develop is a healthy lifestyle, low inflammation. We're feeling better. Our joints are working like they're supposed to. Our heart's working like they're supposed to. All of our vessels, everything in system is working. And that's what helps lead to chronic inflammation. Leads to depression. It leads to anxiety. It leads to just not feeling well. And this is a huge thing. If we can start producing more foods that are not, we always say that, for one saying that I love is that it's not about fixing it with the pharmacy. One of our biggest problems is we need to fix it at the grocery store. I can always be skinnier. My patients can always be skinnier, but it's not about just losing weight, even though that's important. Exercising, which is important, releases those good endorphins. It's about making the small changes over long periods of time. One of the biggest things I preach to my patients is the 80-20 rule. 80% of the time, we're trying to fit a lot of these foods in there. It's our lean proteins. It's our chicken, our fish, our turkey, not as much our red meats. If we're eating our red meats, pick a higher quality red meat that's lower in fat. It's making sure that we're having that balanced diet. And then 20% of the time, enjoy the food. I want you to go have a bowl of ice cream. I want you to celebrate and eat a piece of birthday cake. Those are things that over a lifetime we're going to need. It's just for the everyday major changes. It's making those little decisions each day. And those numbers are going to end up where we want to be. You're going to have more of a low inflammation in your body. You're going to feel better, not have as much of that chronic pain. And then when it gets to the point, this is when you need to talk to your medical provider. We're going to need some medication. So if our blood pressure is going higher, we need that high blood pressure medicine. I write these meds every single day, but for a lot of my patients, it's balancing that preventative medicine, making these changes on your own, and then seeing us healthcare providers to be able to help your cholesterol. Some of this stuff is genetic. So a lot of those patients, they're doing everything they're supposed to do and they still need to go on medication, and that's totally fine. That's where I tell those patients, control what you can control, and then let the technologies of medicine help us in every other area. It's not there to beat yourself up. We do the labs as medical providers to help us point you in the right direction, make the best decisions to give you the best quality of life as long as possible, but it's not there to beat you up. So never be afraid to go talk to your medical provider about it. Don't be scared to know what the numbers. There is power in the information. We can use those numbers and really be able to better explain to you, what your body's going through right now and how we can help. And then you're part of that decision. Don't let a medical provider just tell you what you're going to do. Ask them questions. If you have any questions, leave them in the comments for me. I will answer them to the best of my ability. I like when our patients are informed, because then it's a team effort. And I want you guys to feel empowered. I want you to feel comfortable asking me questions. Like I said, I'm going to answer them to the best of my ability. And then can't wait to see this channel grow. If you want to be along on this journey, please hit that subscribe button as I make more videos. And I'll